Laura and Teresa with another episode of Ask Me Anything. This week's topic is moral fatigue. I'm hearing a lot about moral fatigue in healthcare these days. Teresa, you have been in the dental industry for decades. Is moral fatigue a buzzword? Can you describe it and how it's impacting the dental field?
Sure. Yes, actually, Laura, I don't think that it's a buzzword per se. I think it's just something that's now coming more into the vocabulary and the consciousness of what we see and say. Moral fatigue has been around forever. It's something that's well known to medical providers these days, especially nursing staff and things like that were dealing last year with COVID. You know, they were having to make some pretty horrific decisions regarding patient care at times when maybe their personal standard of care was higher than that, but they were in a position of, you know, you're doing the best that you can with what you have to work with, especially when hospitals got really crowded and things like that. So moral fatigue is actually, it's a very real thing, and medical providers have known that for a long time. Dentistry, I don't think, has just put a name to it. And so that's why I would really like to express this as far as dentistry goes, because I don't hear a lot about it in dentistry, but it does definitely happen. And it's happened to me, and it's happened to a lot of colleagues that I know. And so I just wanted to talk about it just a little bit today.
Well, I'm glad we are. Can you give us some examples of what you've seen?
Yeah, so moral fatigue basically is, when we have to make decisions that are below the standard of care in order to deal with the patient. So sometimes, we get in a dental practice where maybe the doctor is pushing a team member to do something outside of the scope of their license. And, they're reluctant to do that. They know that's not necessarily the right thing to do, but they want to keep their job. And I'm not talking about doing something that's negligent or harmful to the patient necessarily. Mm-hmm. I'm just talking about things that are outside the scope of their license. Hygienists experience a lot of moral fatigue. And the reason that they do so much is because they're in this patient's mouth and they're doing the scaling and they're doing the hygiene visits and the screenings and things like that. And many times they know that these are perio patients, and the doctor diagnoses and treatment plans a prophy for them. And we don't prophy our perio patients because that really doesn't treat the disease that they present with, especially if they have a lot of comorbidities. It really, does not help them in any way. You're not treating that disease. And so, again, they're trying to just do the best that they can for their patient. And so that's really the two areas that I see the most inner conflict, inner turmoil go on.
Okay, very good. So what would you recommend that healthcare providers do to alleviate some of these stresses?
Well, I think one thing is we have to understand that, don't beat yourself up because of the position that you're put in necessarily. If you can get out of that position, I would get out of that position. If going to your doctor or your office manager or something, and first of all, you have to identify the issue. Mm-hmm. Once you really clearly identify the issue, then get a meeting with your office manager, with your doctor, lay these issues out, explain why you're, feeling the way that you do. Chances are you're not only the team member that's feeling this way, and see if maybe you can't bring that to an awareness.
Yeah, absolutely.
If those things don't happen, then, the best suggestion that I can have for you is really, look for a job, look for a position. You might need to change practices to somebody that's got that culture of, higher patient care or more nurturing to the team members and understanding these things.
Yeah, I often go back to, you can't necessarily do better till you know better. So maybe just being in a practice where, like you said, culture, where you feel comfortable communicating and giving feedback is so imperative. And being able to have that confidence or the courage to speak up is huge. You might be surprised, they might be surprised where they actually do have a voice, but they haven't tried to use it before. And so even before you make a change, I think having the courage to step up and actually have that conversation, find out the actual response you get first, because you might be able to make a really positive change in your in the practice that you're working in.
Yeah, that's absolutely true. I think a lot of people will actually quit a job and the doctors really don't know why. They may say, oh, I need fewer hours, or I want to get closer to, and they're making up reasons because they feel like either they can't have that conversation or it wouldn't do any good to have that conversation. And I always say, give the doctor an opportunity to understand what's going on. But the main thing really is, we can't let our moral fatigue get to the point to where we're self-destructive. And that happens. We go home and kind of kick the dog or yell at the kids or, those kinds of things. And, we have to take care of ourselves. So that's really important to find that outlet outside of the practice.
Yeah, I love that you said that. That's always true. We can't help others if we aren't taking good care of ourselves.
Absolutely.
All right, awesome. Well, in our last couple of minutes, do you have any other thoughts on moral fatigue that you want to share with our audience?
Well, I just think that, like I said, the best thing that we can do is identify, bring that to the attention of the people that need to be told these types of things and how we're feeling, and try and affect some positive change in the place that you're at. If that doesn't work, it's time to find a new place, because it will wear on you, and it will wear on you till it causes your self-harm, and we don't want to see that. It's a wonderful profession, and we have great patients that we want to treat, and we're here to do that. So we've got to be able to still do that.
I love it. Email or DM us to get your big questions about your practice answered.